Welcome back to Chill Talk English. I'm Henry.
And I'm Emma. Today we have something special. It's a calm, friendly medical English episode.
Even if you don't work in a hospital, you'll learn useful English for workplace communication.
And if you do work in healthcare, this will feel very real. Teamwork, patient care, and yes, paperwork.
Paperwork is my personal villain. I can handle a busy day, but one tiny box on a form, I panic.
Same. Today's episode is an alternative masterclass style lesson. But we'll keep it simple. Short sentences, clear phrases.
We'll follow a story. One shift, one patient, one student nurse, and one small mistake that becomes a good learning moment.
And along the way, we'll give you ready-to-use phrases. You can copy them for conversation practice and shadowing.
Also, we'll focus on something important. Kind English, not just correct English.
Exactly. Because in healthcare, your words can calm someone down or make them more nervous. All right, let's begin with the start of the shift.
Imagine this. It's early morning, the lights are bright, the hallway smells like coffee and hand sanitizer.
You walk in and you see your coworker. You need a quick update.
Here are start of shift phrases you can use.
Phrase 1. Hi, I'm just starting my shift.
Simple, clear. It tells people why you're asking questions.
Phrase 2. Can you give me a quick handover?
Handover means you receive the patient information from the last shift.
Phrase 3. Anything urgent I should know?
Urgent means important and fast, like right now.
Phrase 4. Has anything changed overnight?
This is great because changed can mean pain, mood, sleep, breathing, anything.
Phrase 5. What's the plan for today?
Notice the word plan. It helps you sound organized.
Quick mini practice. Say these with me slowly.
I'm just starting my shift.
I'm just starting my shift.
Can you give me a quick handover?
Can you give me a quick handover?
Anything urgent I should know?
Anything urgent I should know?
Nice. Keep them in your pocket. Now we meet our characters in the story.
We have Nina, a senior nurse, calm, fast, and always holding a clipboard like it's part of her body.
And we have Leo, a student nurse. Good heart, nervous hands.
And there is a patient, Mr. Park, in room 12. He had chest discomfort during the night. He's stable now, but everyone wants to be careful.
Leo is new, so he wants to do everything correctly. That's good, but he also worries too much.
Like Henry with forms.
Please don't remind me. Nervous laugh. Leo walks up to Nina and says,
Hi, Nina. I'm just starting my shift. Can I get a quick handover?
Nina replies, Sure, quiet night overall, but Mr. Park in room 12 had chest tightness at around 2 a.m.
Leo asks a good follow-up. Is he okay now?
Nina says he's stable. Vitals are better. The doctor ordered an ECG and a chest x-ray, just to be safe.
Leo says, Got it. I'll check the request and follow up.
That phrase, got it, is friendly and professional.
And follow up means you check again later and make sure it happens.
Now, Leo goes to see Mr. Park. This is where patient communication matters. We want English that is clear, respectful, and warm. Leo enters the room and says, Good morning, Mr. Park. My name is Leo. I'm a student nurse.
Great intro. Name and role. Simple.
Mr. Park says, Morning. I'm feeling better, but last night scared me.
Here's a supportive phrase. That sounds scary. I'm glad you told the night team.
Notice, you don't say, don't worry. Sometimes people are worried. Instead, you validate the feeling.
Another helpful phrase, how are you feeling right now?
Open question, not yes or no. Leo continues, I'm going to check your vital signs.
Vital signs, blood pressure, heart rate, temperature, breathing rate.
Then he adds, is it okay if I check your blood pressure?
That's consent. Polite.
Mr. Park nods. Leo checks, then says, your blood pressure looks steady this morning.
Looks makes it softer, friendly.
And then, if you feel dizzy or uncomfortable, tell me right away.
Great safety phrase. Let's give listeners a mini list of patient-friendly phrases that are easy to pronounce.
Phrase 1. I'm here to help.
Phrase 2. I'll explain each step.
Phrase 3. Tell me if anything feels uncomfortable.
Phrase 4. Do you want a moment?
Phrase 5. Thank you for your patience.
Now the story continues. Leo needs to give morning medication, but he's a student nurse, so he needs supervision.
He goes back to Nina and says, I'm still a student, so I'll need supervision for medication.
Perfect. Clear boundary, patient safety first.
Nina says, good, I'll come with you.
They return to Mr. Park. Leo says, these are your morning tablets. This one is for your blood pressure. This one is to protect your heart.
Simple explanations help patients trust you.
Then he adds, please take them with water.
Great. Now we introduce the stressful part.
The student nurse makes a documentation mistake.
Not a medication mistake, a chart mistake. Still serious, but fixable.
Later, Leo is writing in the medication record. He is tired. Someone calls his name. He looks away. And he writes 50 milligrams instead of 5 milligrams, 1 extra 0.
That can be dangerous if nobody catches it.
But Leo catches it. His face goes white. He feels sick.
He goes to Nina and says, can I speak to you for a moment? I think I made an error in the chart.
That is a strong, professional sentence. Nina says, thank you for telling me. What happened? Leo says, I wrote the wrong dose in the record. The patient did not receive the wrong dose, but the chart is wrong. Nina replies, okay, take a breath. We'll correct it properly and inform the right person.
I love that. Calm leadership. Let's teach the key mistake and fix phrases.
Phrase 1, I think I made a mistake.
Phrase 2, I want to report it properly.
Phrase 3, can we correct the record?
Phrase 4, I'm not sure. Can I double-check with you?
Phrase 5, thanks for your guidance.
And one more that saves lives. Please check this with me.
Yes, 2 pairs of eyes are better than 1.
Nina and Leo go together to fix the chart. Nina shows him the correct process.
Leo feels ashamed. Nina uses a supportive phrase. This is a learning moment. What matters is that you noticed and spoke up.
That sentence is gold.
Because it builds a culture of safety, not fear.
Now, later in the shift, Mr. Park needs to go for a chest x-ray. He looks nervous again.
Here comes emotional intelligence English.
Leo says, I can see you look worried. Do you want me to explain what will happen?
That is gentle and clear.
Mr. Park says, yes, please. I don't like machines.
Leo says, that makes sense. The scan is quick and painless. We're doing it to be thorough.
Be thorough means to check carefully.
Then he adds, I'll stay nearby and I'll check on you after.
That offers support without making big promises.
Quick note for learners. Avoid big promises like, everything will be fine.
Better, we're monitoring you closely.
Or, we're doing everything we can to help.
Those are honest and calming.
Now we cut to a lighter moment. Lunch break.
The legendary lunch break that lasts 7 minutes.
Leo says, I feel silly about the chart mistake.
Nina replies, "You're not silly. You were responsible."
And then she adds a practical tip. When you write doses, slow down. Say the number in your head.
Great advice.
Nina also gives him a phrase to use with colleagues. Sorry to interrupt. Quick question.
Very useful in busy places.
Leo practices. Sorry to interrupt. Quick question. Can you check if I've done this correctly?
Excellent. That sentence makes you sound polite and safe.
After lunch, they get an update. The doctor reviewed Mr. Park's results.
The ECG looks normal. The X-ray is clear.
That's good news, but they still monitor him for the rest of the day.
Leo goes back to Mr. Park and says, Good news, your results look okay so far.
Then, the doctor will review everything, but you're stable right now.
Stable is a key word in medical English. It means not getting worse.
Mr. Park smiles and says, Thank you. I feel calmer now.
Leo says, You did the right thing coming in.
That removes guilt. Many patients feel they are wasting time.
And Leo adds, If you feel chest tightness again, tell us right away.
Clear instruction. Safety.
Now, end of shift language. This is another important part of healthcare communication.
Because the next team needs clear information.
Here are end of shift phrases.
Phrase 1, I've handed over to the next nurse.
Phrase 2, the notes are up to date.
Phrase 3, is there anything else you need before I leave?
Phrase 4, I'll tidy my station.
Phrase 5, thanks for your support today.
Simple, polite, professional.
In our story, Leo says to Nina, thanks for your support today. I learned a lot.
Nina says, You worked hard. You asked good questions. That's how you grow.
Leo smiles. He looks tired, but more confident.
So, what did we learn today?
We learned useful English for starting a shift, speaking with patience, teamwork, handling mistakes, and ending a shift.
And we learned a bigger lesson. Calm words create calm moments.
Even if you feel nervous inside.
Especially then.
Before we finish, let's do a short shadowing set. Repeat after me.
Can I get a quick handover?
I'm going to check your vital signs.
Tell me if anything feels uncomfortable.
I'm not sure. Can I double check with you?
Thank you for your patience.
Nice work. If you enjoyed this episode, come back and practice again. Repetition is the secret.
And if you're a healthcare worker, tell us, what phrase do you use most at work?
We'll see you next time on Chill Talk English.
Take care and keep practicing.